Hi, welcome. Once again, I'm Dr. Adams Yakubu, and today I'll be talking about yeast infection, that is vulvovaginal candidiasis. I promised I wasn't going to use too much of the medical jargons, so we'll get to interact and understand each other very well. Now, I also promised that today I'll be telling us about the so-called toilet infection. Well, toilet infection is a blanket um, name for all female genital tract infection because it's non-specific, and that's why in medical context you never come across any such diagnosis because it's non-specific. Now, I would like to talk about vulvovaginal candidiasis. Vulvovaginal candidiasis is a fungal infection of the outer wall of the vagina and the vagina itself. Now, how is this transmitted, or how do women get vulvovaginal candidiasis? It is found mostly amongst women who are immunocompromised, women on long-term steroids. It can also be found amongst women who are on cancer chemotherapy. It can also be found amongst women who have HIV, very important. Then it can also be found amongst women who are in the habit of abusing antibiotics. Every small fever, you go and take antibiotics. Every small condition, you take antibiotics. And then to those of you who use ampiclox as emergency contraceptives, detest from that, because these are some of the contributing factors to drug resistance and, of course, candidiasis. Now, women who are obese are also at risk of having vulvovaginal candidiasis. Women who or ladies who indulge in unprotected sexual intercourse are also at risk of having vulvovaginal candidiasis. Extreme of age, elderly, because of their immune status, yes. Then people who use tight-fitting nylon undies also provide necessary environment for Candida albicans, that's the name of the organism, to thrive. Now, this organism has great affinity for warm, moist environments, and that's why we discourage the use of nylon panties, nylon undies generally, because it provides that enabling environment for the yeasts to proliferate and grow. So try to use well aerated cotton material for your undies. Now, a lot of people who are immunocompromised actually have vulvovaginal candidiasis. Of course, a lot of women who are immunocompromised tend to have vulvovaginal candidiasis. Now, women who share toiletries also are at risk of having vulvovaginal candidiasis. Very importantly, hygiene is very important. Hygiene is very important. After cleaning up, after using the toilet, after defecating, the way you take care of yourself, the way you clean up after defecation is very important. Now, you don't clean up upwards, because when you clean upwards, what you're doing is you're actually contaminating the vaginal area with fecal content from the anus. So after defecation, when you're cleaning up, when you're washing up, you wash from behind. That way you will not introduce it into the vagina. Then also, very, very important, those of you who are in the habit of using soap, detergents to wash the vagina and the vulva, you are doing more harm than good. Because what you do is, there's what you call the normal flora. The normal flora is, in the simplest terms, it's an aggregation of microorganisms, more or less bacteria, that dwell in the vagina. They don't pose threats, they don't pose any harm, but they secrete certain chemicals, or their presence itself provides protection against other harmful agents. It sounds quite amazing, yes? Yes. Now, it's so natural that there are certain microorganisms that dwell in certain parts of our body, that they don't harm us, but their presence scares away some of the harmful microorganisms. So, and the vagina is one of such areas that has this normal flora. Now, when you wash, or when you take antibiotics indiscriminately, what you do is, especially broad spectrum antibiotics, what they do is they destroy the normal bacteria, the normal flora that's supposed to protect the vaginal environment, and thereby giving room for other harmful agents like Candida albicans to take over. Then, the vaginal area itself, the pH is acidic. So when you use some of these soaps, what you do actually is to change the acidic nature of the vagina and tilt it towards the basic pH. And once that pH has been altered, the pH has been altered, you give room for other harmful organisms to come in to play. So, we advise that if you must clean yourself, if you must take care of the vagina, then you should use clean water. Clean water, yes. We don't advise douching. I already made mention of that. We don't advise douching. Then you can also do seed baths. It's okay. You can do seed baths with warm water and salt, and you sit inside the solution. It has to be a super saturated solution. It means the salt you're going to add in the water has to be crystallized. So it means you'll be adding the salt and you'll be mixing it until the salt stops dissolving. Then at that point, when you see a collection of the salt crystals in the solution, you have your super saturated solution. So at that point, you're ready for a sit bath. So you off your dress, your undies, you sit inside for 10 to 15 minutes. You can do that twice every day for 5 days, which is okay. There are other agents people use, like some use boric acid, some use vinegar, but sit bath is good. And then, of course, avoid the use of tight-fitting nylon underwears, because just like I explained to us, that the Candida albicans thrive in warm, moist environments. Then, partners should be treated. Very important, because when a woman is treated and her sexual partner is not treated, he becomes a reservoir. Unfortunately, men don't manifest with the classical features of candidiasis. They become reservoirs. The only thing some men might experience is itching, jock itch, itching around the groin area. But that's what they can come up with. Else, they're usually asymptomatic. Now, to those who abuse antibiotics, we discourage that. If you have any reason to take antibiotics, you come to the hospital and see a doctor for proper screening and proper testing, and then, of course, the appropriate antibiotic will be prescribed to you. Those who have multiple sexual partners, please abstain. As difficult as that might be, but your health is very much more important. Now, women who have vulvovaginal candidiasis, how do they present? What are the signs and symptoms? They present with vaginal discharge, and this vaginal discharge is characteristic of milk-like appearance. We call it cord-like. It appears like milk, thick, white, yellowish discharge, and also associated with severe itching. And some women might experience pain during sexual intercourse, which is otherwise also known as dyspareunia. Some might experience swelling, around the vulva as a result of the inflammatory changes that occur around that area. And when they come to the hospital, most times that area appears reddish and swollen, and some areas of excoriation because of the itching, because of the scratching, can be observed. So, how do we treat? We usually treat with antifungal agents. Just like I told you, I don't mention specific drugs in my discussion because I try to discourage self-medication. The essence of this presentation is to educate you, and of course to expose you to the knowledge of some of these medical conditions, and so as to be able to identify them and seek for medical attention as soon as possible where necessary. So that's for vulvovaginal candidiasis. Very important. Avoid the sharing of toiletries. Avoid sharing of toiletries is very important. And then, also very important, to those who engage in oral sex. Well, you agree with me that in this context, you actually expose yourself to risk, especially the male partners. Simple reason is because if you engage in oral sex with a woman who has vulvovaginal candidiasis, it means you are practically introducing it into your mouth, and thereby exposing yourself to oral thrush and possibly esophageal candidiasis, which is not something you wouldn't want, something you would want to have. All right. So basically, these are the, and then of course we also discourage the use of scents and scented soaps or detergents in the vagina, especially for those who engage in certain cultural practices where insects are used. Incense are used. We discourage such practices. I hope you have been educated by this presentation. So don't forget to like, comment, and subscribe. So I'll see you in the next video. Thank you and goodbye.